Hi, this is Matthias Friedrich for CVI Plus, and I'm here with Carlos Rochitte from Sao Paulo in Brazil. And Carlos, you are the lead for the regional chapter South America of the Society for Cardiovascular Magnetic Resonance. So just a question, how is CMR doing in South America in general?
I think it's doing pretty well, Matthias. Thank you for asking. I think recently Latin America has experienced important growth, economic growth, and I think that's very fortunate. And in terms of that helped cardiac imaging in that sense, especially cardiac MRI has grown in a steady fashion in Brazil particularly, but also in all Latin America, as my colleagues from other countries are saying.
Yeah. How many active centers are there which do a relevant number of cardiac MR studies?
I think in Brazil for now, of course, there are a lot of centers on the big capital states, but we already have several, at least one or two sites in every capital state in Brazil. Brazil is pretty big, has a lot of states in very further and even low economic income areas. But even though there we have a very well distributed number of centers in Brazil. In terms of the community, I can say that we're reaching 200 people working on cardiac MRI right now.
Oh, wow.
That's a very sizable number.
Yeah.
And the big centers like big cities like São Paulo and Rio, the numbers of cardiac centers has surpassed 20 in each of the cities.
And which indications are you most interested in Latin America?
I'm interested in several indications, but I think the flow that we're receiving from the referring physicians in Brazil has been very strongly on cardiomyopathies, followed by viability and ischemia.
Okay.
I think that's, for our experience, cardiomyopathy investigation has been probably the leading indication for us.
And are there any specific challenges to CMR in South America?
I think there is some challenges as well in other parts of the world, but I think some of the challenges has to do with reimbursement is still quite low in Brazil. Several private insurances are still not covering it in an appropriate mode, I would say, and also physician education. I think in the major cities and major areas where we are close to the universities and tertiary centers, most of the physicians are educated already and are referring for cardiac MR when needed. But in other areas, this is still not as quite we would expect. But we're improving on that. I think we're going.
And last quick question: where do you see this going in the future? Will it more increase? Will it stay flat?
I think the near perspective, I would say, for the next 5 years in Brazil and Latin America is a really growth, very strong growth, I would say, because of economic growth that we just have been experienced, and the perspective on the economic, and especially not only on the economic in general for the country, but the possibility that a big, I would say that a big part of the population that had not access to the healthcare organizations or healthcare in general became able economically to access that. So that is, and it's not a small number of patients. It's a big number of patients. You know, Latin America is pretty big. Okay. So this will definitely increase in the next couple of years, at least in the next 5 years in Latin America. So we're expecting a big growth there.
Thank you very much, Carlos, for joining us, and all the best for the development in South America.
Okay.
Thanks very much for watching. That's Matthias Friedrich for CVI Plus.